Good day, listeners and viewers. On today's COVID 19 update, Minister of Health Dr. Frank Anthony warns against forging COVID 19 vaccination cards and assures that there are enough vaccines for everyone. I want to ask you, with plans for the reopening of schools in September, has the ministry received any special requests from the Ministry of Education to facilitate this?
Well, we have a joint committee between the two ministries, Ministry of Health and Ministry of Education, and we have been in constant talks pertaining to reopening of schools, safety of school children when they get back to school, and so forth. And more recently, we have been in discussion with the Ministry of Education and its top leadership. And one of the things that was discussed at the last meeting pertained to how, when we get vaccines, how we are going to roll that out within the school system. So those discussions are still ongoing.
Is the ministry trying to procure vaccines for children? Are there any particular measures that would be needed to facilitate this process, such as the legalization, infrastructure, anything of the sort?
First of all, the government of Guyana is actively working to get vaccines for children. There have been two vaccines that have been given emergency use authorization in the United States, and that is the Moderna vaccine and the Pfizer vaccine. And so far, they're being used for persons between 12 to 18. And we are actively trying to get those vaccines into Guyana so that we can administer it to our children. Recently, there have been reports that in some countries they've been using Sinopharm, but we are awaiting the data to see whether or not Sinopharm can be used. But as of now, we're working to make sure that we get the vaccines, Pfizer and Moderna, or Moderna, to be used in our children population.
And would the COVID 19 vaccine for children be optional?
There is an existing immunization law in Guyana as it pertains to children, and we will be giving those vaccines in accordance with that particular law.
On the issue of fake vaccination cards, can you get a comment on persons forging the second dose information?
Well, I'm not sure why they would forge second dose information, but as I've said before, the three vaccines that we're using, we have adequate first and second dose for AstraZeneca and Sinopharm. We've had a challenge with the Sputnik V, but again, we have a first dose that is available, and we are working to make sure that we get the second doses. So those who have received their first dose Sputnik V are going to get their second dose because we're going to make sure that we get it and we administer it. Now, we have had some reports that there are people who are selling the cards, and there are people who are unvaccinated who are buying the cards. So I just want to remind the general public that in Section 240 of our criminal law, or Criminal Offences Act, Chapter 801, forgery is an offense, and you can be prosecuted for forgery. And the fine, if you're found guilty of forgery, would be up to 3 years imprisonment. And if you forge a vaccination card, then you'll be liable to this type of punishment if caught. So I want to encourage people to desist from such practices, because when we catch you, you're going to feel the full brunt of the law. So that goes for the people who have access to the vaccination card, and the people who are buying the vaccination card, if there are such actions that are currently ongoing. So I just want to warn people that this is an offense, and we'll be taking very stern measures against anyone who's trying to do this. As of yesterday, we have 254,883 persons who would have received at least one dose of their vaccine. That means that for first dose, we are now at 52.4% of our adult population. For second dose, we are now at 142,114 persons who would have received their second dose vaccine. That's approximately 29.2% of our population. There are a number of vaccines that are currently available on the market. The only single dose vaccine there is the Johnson & Johnson vaccine. So if you get one dose of that, you're considered to be fully vaccinated. All other vaccines that are available, whether it's Pfizer, Moderna, AstraZeneca, Sinopharm, Sputnik V, they require 2 doses. So unless you get both doses, you're not going to be fully vaccinated. And for you to really get the benefits of vaccination, you need both doses. In some countries, they are now talking about having a third dose, but we'll wait and see when there's more data on that, whether or not people would need to have a third dose. But for now, the vaccines that are currently available, there are 2 doses, and we recommend that you get both doses. Persons in Guyana who have been fully vaccinated have not, they have been protected. So we haven't seen persons who are fully vaccinated being hospitalized for COVID, nor have they died from COVID. So I want to make that very important point to everyone because it is significant. These vaccines, if you're fully vaccinated, can make the difference between life and death. So I just want to urge people, if you got your first dose, make sure that you get your second dose.
That's it for our COVID-19 update. For more information, visit health.gov.gy or dpi.gov.gy and our social media platforms.